Does hip osteoarthritis cause knee osteoarthritis? The answer is no, it does not. And this is contrary to what most healthcare professionals say, because they'll often say, oh, you have hip arthritis? Well, it's just a matter of time before the knee arthritis comes in. Or they'll say it the other way around. Oh, you have knee arthritis? Well, it's just a matter of time before the hip arthritis comes on. But that is not the cause. If we're talking about the root cause of hip arthritis or knee arthritis, it's a muscle imbalance where the quads are too strong, they're too dominant, they're being used too much, they're compensating for weakness up in the hip, on the backside of the hip, the glutes. When those glutes get weak, it changes the way the ball moves in the joint where the ball and socket is. And because this is one continuous bone, the femur, the thigh bone, if you don't have good glute strength up here and it's altered, the stability is altered at the hip, it's also going to affect the pressures and the stability around the knee joint. That's the cause of hip and knee arthritis. But because this muscle imbalance affects this entire bone, that's why you see people that get hip arthritis and knee arthritis together at the same time. It is not that hip arthritis causes knee arthritis or that knee arthritis causes hip arthritis. I think it's especially important for you to get this straight in your head because most healthcare professionals don't understand this. They don't understand the concept of muscle imbalances. They're just thinking in terms of what research says and what correlations say. Correlations are not describing cause and effect. When you see a correlation, that just means that as this tends to happen, this other thing also tends to happen. But it doesn't describe cause and effect. So as we see somebody develop hip arthritis, we also tend to see somebody develop knee arthritis. But it's not accurate to say that the hip arthritis caused the knee arthritis. Like the actual changes in the joints are causing the actual changes in the knee down here. What you need to think about instead is it's the pressures that the muscles are creating. This is important because when you figure out what the cause of something is, then you can begin to determine what treatment you need to fix it. And if you just leave it at the level of thinking of, well, I have hip arthritis and that's causing my knee arthritis, where does that put you? How are you going to fix it? What treatments do you have? Then it makes sense that somebody says, well, let's get a hip joint replacement so that you can salvage your knee. That is not good thinking. And vice versa. Well, the knees are worse than the hip, so why don't we get a knee replacement so we can salvage the hip and avoid the hip replacement later on? Not good thinking. This is very short-sighted. This is what our current medical field at large is doing to people. And I really think that everybody's doing the best they can with what they know. Like, I'm not trying to throw anybody under the bus here. I think surgeons in the world are fantastic and they do great work. And sure, there's always a bad seed, just like every other profession. There's always a bad teacher, a bad lawyer, a bad whatever, but there's a lot of good ones too. And I'm willing to bet money that most surgeons out there are doing the best they can with what they know to help their patients, and they truly have their patients' best interests in mind. The limitation is that they're not educated in how to solve problems without surgery very well. The sooner you can understand that, the sooner you can begin to see that maybe their treatments are not the best thing for you to be doing right now. Because if you can bend your knee all the way, if you can straighten your knee all the way, and if your hip has good motion up here in the ball and socket joint, what I see personally as an expert in helping people avoid surgery is that you just need to get stronger in the right areas. You need to fix this muscle imbalance because that's the real root cause of arthritis in the hip and the knee. If you can get your glutes stronger, if there's other muscles too, like your foot, if you can get the right muscles in your feet stronger, then you're going to have much better stability in the knee joints. The pressures are going to be reduced, the bad pressures, and same thing up in the hip. You're going to move the hip joint properly, and you're also going to restore normal pressures in the hip. Pressures are a good thing in these joints. Joints are designed to take pressure. Joints are specifically designed to take pressure and allow movement at the same time. That's why they're designed the way they are. Problem comes on when you're trying to do those same movements with excessive pressures because of muscle imbalances, because there's muscles pulling too much on one side of the joint. Now it's causing bad pressures to go through the knee, and same thing up in the hip. Now, there are other causes out there that people blame arthritis on. Some of the big ones are age. They'll say, Well, once you hit your 60s, the likelihood of you getting arthritis in the hip and the knee just starts to go up. And every decade of life, it just goes up and up and up and up. And yeah, there's research showing that that happens. But again, it's a correlation, not cause and effect. There isn't causality established. Another one is weight. We see that as people are heavier, they tend to have a little bit more arthritis in their hips and knees. But could it be that they're also sedentary and they're not working out muscles properly and they have a worse imbalance? You see how there isn't true causality developed. Now, I do think that genetics can play a role into this, because you'll see people say, well, it's genetic. You know, you're more likely to get arthritis if your parents had it or if your grandparents had it, or if you have genetic shapes of your knees, or like if you're more bow-legged or knock-kneed, then it's going to change the forces in your knee. I absolutely agree. But just because you're genetically predisposed doesn't mean you can't prevent it. I mean, people that have diabetes aren't absolutely going to get diabetes all the time. I'm talking about type 2 diabetes. They can modify their diet and their exercise and get rid of diabetes or prevent it altogether. You're not just destined to have diabetes. It's the same thing with arthritis. You're not destined to have arthritis that stops you from doing everything. If you manage your muscle balance, if you exercise properly, safely, in a way that doesn't aggravate your joints, your knees or your hips, then you should be able to maintain healthy hips and healthy knees into your older years. It's a matter of the muscle imbalance, not one joint is causing the other joint to have arthritis.